Patrick.
On the news at 5:30 this evening, almost 6 more weeks of lockdown. The government confirms level 5 COVID restrictions will remain in place right through next month and into early March.
We cannot give the virus or its variants any space. Therefore, government has decided to extend all of the current level 5 restrictions until the 5th of March, with a view to crushing the numbers.
The bulk of people arriving into the country from abroad will now mandatory quarantine either in a hotel or at home. More Garda patrols are also planned close to airports and ports to deter non-essential travel. The €100 fine for breaches is also set to increase. But the plan has been slammed by opposition parties who claim it doesn't go far enough.
Trying to live alongside COVID is like trying to play footsie with a tiger. It just does not work.
The Taoiseach says if COVID transmission numbers keep moving in the right direction, the case is strengthened for a phased reopening of schools.
If we keep doing those things, then we'll have case numbers down to a level much lower than they were when schools were open. And I think that does allow the prospect for a safe reopening of schools on a phased basis across February and March.
But students still have further questions about the fate of this year's Leaving and Junior Cert exams.
It's infuriating to see that there's still a want to sit the traditional Leaving Cert despite the fact this year has been so unnatural for so many students.
Good evening. The government has confirmed almost 6 more weeks of level 5 COVID restrictions right through February and up to early March. The extension was approved by ministers, along with tough new measures around international travel, especially for arrivals here and those continuing to travel abroad for non-essential reasons. Here's what the government has agreed. As widely flagged, our current level 5 COVID lockdown will be extended until Friday, the 5th of March. Quarantine in a hotel for up to 14 days will be mandatory for anyone arriving into the country without a negative COVID test. It will also apply to arrivals from Brazil and South Africa. Self-isolating at home is also set to become a legal requirement for those returning into the country from foreign holidays. Garda checks will be stepped up around the country's ports and airports in a bid to deter non-essential travel abroad. The €100 fine for breaches will increase. The government was also considering checkpoints 5 kilometres from the border, but no decision has been taken. The Taoiseach said the aim of the tough new measures is to crush our COVID transmission rates.
Ministers arrived for today's cabinet meeting where they agreed to extend the current lockdown.
The restrictions will continue to the 5th of March. Yesterday's presentations would suggest that even, if we do that, we would still have a significant number of people in hospital at the end of February.
After the meeting, new restrictions were also confirmed, including the suspension of visa-free travel from South Africa and all of South America. There will also be mandatory hotel quarantine for anyone arriving here without a negative PCR test or travelling from Brazil or South Africa, and mandatory home quarantine for everyone else, while extra checks will be in place around ports, airports and the border, and there will be increased fines for those intending to travel. However, new legislation will be needed before the measures are fully implemented, which could take a number of weeks.
Restrictions on people's movement and people's freedom are exceptionally difficult. The true toll that they are taking on people's mental health and well-being is as yet unknown, but it is significant. The road we are on is hard. The length of time that we've had to live with restrictions and the proximity of vaccination makes it even harder. But it is the road we must take together. We have done it before and we can do it again.
With the Taoiseach explaining the rationale behind today's decision.
First, to reduce daily case numbers, that's new infections, down to a very low level by the 5th of March. Second, to allow our hospitals, our ICUs and those who work in them time to recover from the surge that they're currently still experiencing. Third, to enable a phased opening of schools across February and March, starting with children with special educational needs. And fourth, to get the vaccine out to more people.
But advocates of a zero COVID strategy have criticised the plans, with many saying there needs to be mandatory hotel quarantine for all arrivals. Nicole Gernan, Virgin Media News.
Right, let's get more on what's been announced in the last hour by Government. Our political correspondent Gavin Riley is at Government Buildings. And Gavin, doubts already raised at that briefing about what next Christmas is going to look like.
Absolutely. Micheál Martin saying first and foremost that although those lockdown restrictions are being extended to March the 5th, that no one can be absolutely sure that they can be lifted at that point either. The Taoiseach saying that NPHET's best case scenario is that at the end of February there could still be between 800 and 1,300 COVID patients in hospitals and around 100 people in intensive care, and that is far higher than a metric that either himself or Leo Varadkar had given previously for the relaxation. So there's a prospect of this level 5 going into March and possibly well beyond St Patrick's Day and towards Easter, but also then the prospect of there still being some restrictions up right until towards Christmas, and that's despite the pledge of having everybody in the country, all adults at least, vaccinated by the end of September. Now this gives rise of course to the whole debate around zero COVID and whether that is an applicable strategy. Micheál Martin saying it simply couldn't be relied upon because there would be no way to truly stop new variants from coming back and being seeded into Ireland even if the virus is eradicated on the island.
The sense is we've never been advised to go into zero COVID, and I don't think it's possible or sustainable in terms of a zero COVID strategy because, as put to us last evening, it's a promise that you could never fulfil. In terms of once you reopen again, the prospect is there for reseeding of the virus.
Now, there were follow-up questions along that line as well. For example, if you were to have all adults vaccinated by September, why couldn't you perhaps seal the borders or enforce mandatory quarantine up until that point? And then when everyone in Ireland was vaccinated, why then you couldn't allow international travel and potentially have other viruses brought back in? And Leo Varadkar and Micheál Martin both said that you can't necessarily rely on mass vaccination to confer herd immunity, that they said that public health officials are being very cautious on that, and although it may be perceived in the general population that simply vaccinating everyone would make this problem go away, that you would have to wait and see exactly what the effect is of giving a vaccine to all adults. And Stephen Donnelly made the point then that even if everybody was vaccinated from the strains that we know about, there's a prospect of a new variant being imported into Ireland after you vaccinate everyone, which perhaps could be immune to vaccines. So altogether a very gloomy outlook, and Leo Varadkar saying towards the end of the press conference this evening nobody can be quite sure whether we'll be allowed to have the full social lives and full travel lives that we all would like come Christmas 2021 either.
OK, Gavin, thank you for that. Well, let's get the reaction of opposition parties and the medical community now to the new government measures. Richard Chambers is at Leinster House for us this evening. And really, Richard, opposition parties saying this is too little too late.
Yes, Colette, nobody really happy at all around Leinster House amongst opposition benches about the government's announcement this evening and ahead of it, as it was widely flagged, particularly around the issue of travel. A number of opposition parties hitting out at the PCR test requirement for quarantining, saying that the PCR test 72 hours before arrival into Ireland is only a snapshot in time, and the most dangerous part of the travel is actually when you are in transit on an airplane heading towards Ireland, that the 72-hour requirement for PCR test really has no effect, and NPHET has made that clear. It says that 40% of cases arriving into the country are being missed in that regard. But particularly on the issue of mandatory hotel quarantine for all arrivals into this country, that is what opposition spokespeople have been shouting for today. They say the government is putting health and lives at risk by not implementing it.
Trying to live alongside COVID is like trying to play footsie with a tiger. It just does not work. We need to end the ad hoc, piecemeal, reactive approach to dealing with COVID-19 because it has failed us, and instead pursue a comprehensive alternative zero COVID strategy that seeks to eliminate community transmission and then allow us to get past this terrible cycle of surge and lockdown.
Well, advocates for zero COVID in the scientific and the medical community say that mandatory hotel quarantining for all arrivals is the only way to ensure that you have some protection from new variants which can continue to evolve and could at some point in time become resistant to COVID-19 vaccinations. That is the worst case scenario, but Tomás Ryan of the Independent Scientific Advocacy Group says the government must do that now and that there are no excuses.
It is essential that we keep the virus from reseeding the country. Otherwise, we're making a mockery out of everything that we're doing as citizens in enduring lockdowns in our community. On top of that, we have to prevent new variants coming in because the virus is evolving under the pressure that we're putting onto it globally. There are variants emerging that are more virulent, that are clearly more transmissible, and that are becoming more resistant to the vaccines, which could result in a pandemic within this pandemic, which we're now currently facing.
Well, opposition politicians also pointing to their concerns about the re-emergence of clusters in workplaces like meat factories. They're also calling on the government to beware of lobbying and business groups calling for the early reopening of things like hospitality. They say that it is not safe to reopen the country if there are multiples of hundreds of cases in a few weeks' time, Colette.
Richard, thank you very much for that update. Well, making the announcement this evening, the Taoiseach Micheál Martin said the extension of level 5 restrictions and the new travel measures are designed to relieve pressure on the country's hospitals. Zara King is at the Department of Health for us this evening. So, Zara, what is the situation in the country's hospitals this evening?
Yes, Colette. Well, I suppose the Health Minister saying earlier today that we had reached our peak in terms of numbers in hospital, but in terms of the actual situation on the front line for the workers and for the patients, it remains very, very difficult. This evening there are 1,823 COVID patients in hospital, of which 216 are in the intensive care unit. And we know that there are people outside the intensive care unit who are still receiving very high level interventions in terms of respiratory infection. In fact, there's almost 400 people in what they call the orange zone. So the reality in the hospitals is still very, very grave. This afternoon we were speaking with Anne O'Connor, who is the Chief Operations Officer with the Health Service, and she's been telling us that they're working behind the scenes, constantly trying to redeploy staff into areas where they need them, because we know that there are up to 6,000 frontliners within the Health Service absent at the moment because either they have COVID or they've been identified as a close contact of a confirmed case. Anne O'Connor saying today that while the Health Minister is right to say that perhaps in terms of numbers we've reached our peak, the situation does remain serious.
So if you look at it from the numbers every day in hospital, yes, it has started to come down. I think from our systems perspective, though, we are still, not feeling that. At the minute, we still have more than double the number that we had at the peak of the first wave of this pandemic. So it's still very challenging. And I think certainly the challenges this time, when you marry the numbers with the staff absenteeism and all of the different challenges around trying to manage challenges in hospitals with challenges in nursing homes, I think it'll be a while before we actually see that ease up in terms of how we're working.
Well, Colette, Anne O'Connor, they're saying, as you heard, more than double the number of people in hospital than we had in the first wave of this virus. We're standing by at the Department of Health waiting for the latest COVID-19 figures. We'll be watching to see if today's case numbers are lower than 2,000. We'll bring those to you as soon as we get them.
Sarah, thank you for that. Well, the government has said this evening it's giving the Minister for Education time and space to work with the education partners around the fate of this year's state exams and the reopening of special education. Let's talk to Paul Quinn on this. And Paul, the phased reopening of schools now back in the frame.
Yeah, well, of course, the original plan, Colette, was that schools would fully reopen next week, but there's still some uncertainty about how and when that's all going to happen and how exactly it would work. Of course, the top priorities being reopening those schools for children with additional needs, and secondly, the junior and particularly the Leaving Cert. Now, as you said, the Taoiseach Micheál Martin this afternoon saying that he is now giving the Education Minister, Norma Foley, some time, some space to work through these issues, to come up with a plan and to work through them with the various stakeholders, including the unions. Now, on a full reopening of schools, the Taoiseach, the Leo Varadkar, also saying that he believes this can be done on a phased basis over the coming months if things keep going in the right direction.
So if we're in around 1,000 now, it's reasonable to project that in 10 days' time, if we all keep doing what we're doing, we could be down to around 500 or 600 cases a day. And maybe in 20 days' time, half that again. Then we'll have case numbers down to a level much lower than they were when schools were open. And I think that does allow the prospect for a safe reopening of schools on a phased basis across February and March, starting with children with special needs, but then potentially moving on to other groups too.
Now, on the Leaving Cert, the department has conceded that other options are being examined, and I think it's fair to say that the traditional Leaving Cert that the Minister and the government had hoped to see, that's becoming less of a reality every day that passes. Of course, students at the centre of all this, the Leaving Cert students continuing to voice their frustration. We've been hearing from some of them earlier today.
It's infuriating to see that there's still a want to sit the traditional Leaving Cert despite the fact this year has been so unnatural for so many students.
134 days away from our first planned Leaving Cert exam with no decision made.
The lack of clarity on the Leaving Cert 2021 has had a tremendous effect on students' mental health. All we're asking for is the Leaving Cert going ahead. Are our practical exams going ahead? Are our oral exams going ahead?
Now, the advisory group set up to look at this Leaving Cert exams is due to meet in the coming days. Still unclear, Colette, whether we'll get a final decision sometime later this week or perhaps early next week.
Paul, thank you very much for that update. Well, the Health Minister, Stephen Donnelly, has given an update on the delivery of the AstraZeneca vaccine. Our economics correspondent, Paul Coggan, has more on this, and a lot of focus now on this row between the Commission and the maker of the vaccine.
Yes, this has been described as a fiasco, and it is something that is knocking back our vaccination programme and the vaccination programmes of many other EU member states. This Oxford AstraZeneca vaccine, which is due to land in the middle of February, is due to be authorised this Friday. It's been described with the Taoiseach as a game changer. It would see hundreds of thousands of people vaccinated, quite potentially, by the end of March. But AstraZeneca, as we know, have said they're not going to be able to meet their delivery commitments. There was 2 meetings with the European Commission yesterday. They didn't go well. There's another one planned for tomorrow. And there's been furious political reaction right around Europe. Europe is now talking about a new mechanism whereby companies that manufacture vaccines within the EU would have to notify the European Union of any plans they have to export them to third countries like the UK. And as you say, the Health Minister, Stephen Donnelly, is trying to get his head around what's coming next. He was asked about this a short time ago at that briefing. This is what he had to say.
We are not happy with the news from AstraZeneca. They've announced that they intend delivering significantly less than what was agreed with Ireland and the other EU member states. The numbers have not been finalised between AstraZeneca and the EU. We're working very closely with our EU partners with the aim of maximising the volume of delivery as close to the agreed schedule as possible, and with having the delivery arrive here as soon after authorisation as possible.
So still unclear as to what the actual numbers will be. Pfizer, it has been reported by the Commission, will deliver what it was due to deliver by the end of this week. So that is some improvement. It's unclear if the Oxford vaccine delivery schedule can be fixed in any way. In another development today, Johnson & Johnson have said they plan to report the figures on their vaccine trials next week. That vaccine could be another game changer in the sense that it's one shot. It doesn't have to be stored at very cold temperatures. It can be distributed widely. That could change the whole picture all over again.
All right, Paul, thank you very much for that update. Now, it was announced this afternoon that the UK has passed 100,000 COVID-19 deaths, the 5th highest death total in the world. In New Zealand, no community transmission has been detected after a first COVID-19 case outside of quarantine in over 2 months was reported. And a third night of anti-lockdown protests in the Netherlands saw over 150 people arrested.
The United Kingdom has passed 100,000 confirmed COVID-19 deaths, with a quarter of these occurring in the last 3 weeks alone. The grim milestone comes as 7.3 million coronavirus vaccines have now been administered across the UK.
I offer my deepest condolences to everyone who's lost a loved one. Fathers and mothers, brothers and sisters, sons and daughters, and the many grandparents who've been taken.
In New Zealand, there has been no evidence found that COVID-19 is spreading in the community after their first case outside of a quarantine facility in over 2 months was detected on Saturday. Prime Minister Jacinda Ardern says restrictions at New Zealand's borders will remain in place for much of 2021.
But given the risks in the world around us and the uncertainty of the global rollout of a vaccine, we can expect our borders to be impacted for much of this year.
While in the Netherlands, anti-lockdown protests continued in a number of towns and cities overnight in defiance of a new curfew in place since the weekend. Disturbances were seen in Amsterdam, Rotterdam and here in Haarlem, the third consecutive night of protests in the country since the curfew was introduced on Saturday. More than 150 people were detained by Dutch police overnight. Rob O'Hanrahan, Virgin Media News.
And today's government announcement will be discussed in detail on The Tonight Show this evening at 10 o'clock here on Virgin Media 1. Now, coming up next on the news at 5:30, 6 years for the man who held up a judge and barrister in a terrifying courtroom siege. And Man City can go top of the Premier League tonight.
Let's get your mortgage in motion. With KBC, you can get some of the lowest fixed rates. And low rates mean low monthly repayments, which can make all the difference today and tomorrow. Just give us a call, pop into a hub, or chat to your mortgage broker. Let's get your move into a groove. We're ready when you are. KBC, the bank of you.
When it comes to mobile sales, we don't play around. You can grab Virgin Mobile for an incredible €5 a month for 6 months and €25 a month after that. Picking up unlimited data, calls and texts. Bring on amazing. See virginmobile.ie.
Turn around. Every now and then I get a little bit tired of craving something that I can't have. Forever I've been praying for a snack in my life. I finally found the right snack.
Unbelievably great taste. Now with 30% less sugar.
I found him.
At Energia, we're the power behind your rescue and your biggest winter savings when you come direct to us and switch to our cheapest dual fuel bundle. Energia, the power